Hey, it's Dr. Amanda with StraightSmile Solutions, StraightSmileSolutions.com, and today we're going to talk about sports and being an Invisalign provider, or sports and doing braces, and how the sports or the athletic events that your patient does outside school, especially for teens and preteens, can affect the orthodontic outcome and can affect how you set up the treatment plan. And I think that most orthodontists get this, and it's something often we have patient questionnaires, we get to know the patients, and we can kind of integrate this into the treatment plan to make the treatment plan go better, or to even explain to the parent why we're picking a certain system over a different system. And we'll talk more about that in a few minutes. But just in general, I want you to understand that it's really important to get to know your patients and their hobbies, and it really does affect their mouth and how their teeth move. So let's talk about that a little bit more. So I've always used sports to my advantage to help to explain, why we need to do orthodontics or why we need to pick a certain system. I also use sports as an opening conversation that to really support the patient a little bit more about how I believe they're going to be compliant. A lot of times parents underestimate their kids and what they're capable of doing. And when you give the patients a challenge and you tell them as a doctor your expectations, you're going to be a lot more successful with having great compliance than just the parents having to rely on them. So we always like to come in and knowing, what direction the parent or the patient, I want to know both their opinions, not into one unified opinion. Parents may have one idea, kids may have another idea. And then we talk a little bit more about what the kids do outside school, and we try to find the best fit. So, for example, if the kids are in a really active sport where there might be some trauma, like karate, or, certainly soccer, hockey, lacrosse, anything like that, football, basketball, where you can take an elbow to the face, volleyball, you can take a ball to the face, any ball sport or any high impact sport, I'm always going to strongly recommend having Invisalign over braces. It is just going to be a better experience. You're just going to have too much breakage otherwise, and the breakage can cause trauma to the face, and it can also really slow down your treatment. But even other sports, is important sometimes to consider having something that is low or no impact, because you can still fall, get elbowed, get hit in the face. There's still trauma that can happen. So definitely it's something to keep in mind, but also kids that are training at a high level, they're generally extremely responsible. So there's a big difference in doing something occasionally for fun and actually, being a state rank athlete or something like that. So I love to get to know more about sports and then ask questions. Is it club? Are you doing team? Are you doing high school? Are you considering this sport in college? Where are we with this sport? Also, even things like ballet or dance, a lot of times, if they're really high level, the agents or the coaches, they prefer that patients not have metal braces. And of course, this goes also for patients that are in modeling or acting. Certainly, Invisalign is going to be a much more popular product. I know my daughter does some modeling, and that was a big thing they asked about in terms of getting braces or Invisalign. So just things to keep in mind. I really believe that most patients can rise to the occasion when it's something that they want, and especially when they understand the risks, benefits, and alternatives. You explain to them what your expectations, you explain to them what's going to happen if they're not compliant, and from then on, 99 times out of 100, you really have a great experience with almost every patient. And it's all about picking the right patient and parent. Obviously, if the patient's coming in and they're not interested at all in having any type of orthodontic work, and they're sitting there slumped in the chair and they're not looking you in the eye, looking at the floor, they're grumpy, they're unkempt, they're ungroomed, this is probably not a good patient to have in your practice at all. I do not want to battle with teenagers, and that's 1 out of every 100 patients that comes in. There's clearly more that's going on there. There's very few teenagers that are, especially when you bring up Invisalign and clear braces, a lot of people don't want to have metal. There's very few people that don't want to have nice teeth, and sometimes it's a matter of just delaying things for a year until they get a little bit more mature and they're ready to do it. But nobody wants a battle. So anyways, hopefully this was helpful. Thank you.